Now, according to UN AIDS, the inequalities which perpetuate the AIDS pandemic are not inevitable as we can tackle them. This World AIDS Day, December 1st, UN AIDS is urging each of us to address the inequalities which are holding back progress in ending AIDS. As such, the Equalize slogan is a call to action to address such inequalities. Joining me to delve deeper on the issue is President of the Human Resource Management Association of Trinidad and Tobago, HRMAT, and HIV/AIDS Advocacy Officer at the HIV Workplace Advocacy Unit at the Ministry of Labour, Kalisha McLean-Robert. Good morning, Cavell. Good morning, Kalisha.
Good morning.
How are you ladies this morning?
We're fine, thanks.
Cavell, welcome back again. I know that you are no stranger here with us.
Thank you for having us.
Now, I want to start with you first, Kalisha, especially from a Ministry of Labour context. Tell us about the HIV Workplace Advocacy Unit.
Okay, the HIV Workplace Advocacy Unit was established in 2009. This was after a project, an education project, partnering with the International Labour Organization, which revealed that majority of persons with HIV within Trinidad and Tobago were within the 15 to 49 age group. Now, this represents the prime age group of persons within our workforce. And, well, we saw the implications that it would cause later on in our economy, in terms of stigma and discrimination, low productivity, and we took a proactive response. So the HIV Workplace Advocacy Unit was mandated to advocate for this policy. I know a lot of persons may not be familiar with the National Workplace Policy on HIV and AIDS, but we are tasked with that mandate in Trinidad and Tobago. Every workplace, as long as there is an employee or employer, there's work going on, we would contact you at some point in time to either adopt or develop your own policy. So this policy speaks to HIV in the workplace, the effective management of HIV in the workplace. And we work with organizations to develop their policies.
Yeah.
The foundation of this policy is the International Labour Organization's 10 key principles concerning HIV in the workplace, which all speaks against persons living with HIV, the stigma and discrimination of them, as well as the prevention of HIV in the workplace.
Yeah. Can we touch on some, I know you may not be able to address the 10, but can we touch on some of the things that the workplace policy would address?
So one would be for sure confidentiality. If an employee chooses to disclose their status because they do not have to disclose their status. Another would be no screening for the purposes of employment or promotion. Some organizations require HIV testing as a part of their recruitment process, and this should not be so. We have continuation of employment. If an employee chooses to disclose, we advise, or it is key that organizations don't terminate an employee because they choose to disclose or because they are not able at the moment, they are not fit to work, but they are given opportunities to reach that stage. Care and support is a key principle where we ask organizations to work with your employees. What can you offer to your employee? Is it counseling? Is it time off, reasonable accommodations? Time off to go to their clinics? Do you have a work from home policy? So the policy really allows the support for persons living with HIV, as well as I said, the prevention. So a healthy work environment would be another principle, where we speak to universal standards or standard precautions in the workplace. Because a question that we get asked a lot is, so why aren't employees allowed to know the status of another worker? What if something happens? And our response to this question would be, every employer has a responsibility to ensure that the staff, the environment is safe. So if there is an incident in the workplace, there are certain measures across the board, whether there is an employee living with HIV or not. There are measures that should be taken, steps that should be taken, and all employees should be aware of it at all times.
Yeah.
So it doesn't matter if they are positive, they are living with HIV or not. These are things that should be done. And we know across the board, universal precautions. As long as you see blood, you treat it as though it is infected.
I'm going to pause on that for now because I want to hear the HR perspective. Cavell, I'm going to bring you in here because I wanted to know how significant is this policy to the workplace. And I'm asking that because one of the most interesting things you mentioned was that confidentiality. Yes. And I know that sometimes HR gets a bad rap in terms of how much information they may know about an employee. So how significant is this workplace policy to, the HIV policy to the workplace?
Well, it's critical, and that's why HRMAT has come on board to support the Ministry of Labour, and we will in fact be be signing an MOU later today, because we want to ensure that in terms of the stigma, the discrimination, and ensuring best practices for our practitioners when handling persons who choose to disclose or not their status as it relates to being HIV positive. What we've seen, I mean, I've personally experienced this, so that's the thing. Years ago, I started my volunteerism with an organization called South AIDS Support. It's a faith-based organization, and it was all the religious bodies coming together in a response to HIV and AIDS. And I recall working in an organization where the HR director, an employee, was taking a lot of time off from work. It's as Kalisha said, in terms of you have to go to clinic, right? And there was a time when the clinic was separate in San Fernando General Hospital, was a separate clinic because of the stigma. They didn't want, they felt like mixing, you know, if you had to come into the same clinic to collect your medication. So once you turned up to that clinic, everybody knew that you were positive.
Yes.
And there was this employee, and the employee was taking time off. And eventually, the pressure that HR was putting under that employee, the employee disclosed their status. I must say it was the most painful thing that I've experienced, and that is what caused me to volunteer, right? Because that employee, I mean, from her colleagues, not wanting to sit next to her, not wanting to use the same utensils in the shared kitchenette space, to the point that eventually that person left the organization because HR disclosed, by the time she walked out the door, phone calls started to happen about this person's status, right? And this was about 20 years ago I'm talking about. So we see that there's a lot of work still to be done so that HR understands how to manage and how to handle a situation such as that. Because an employee don't have to disclose, but it becomes a productivity issue if you're taking a lot of time away from the job. Now what we found, there's so much progress as it relates to science and technology around medication. So people are living healthy, long lives now, and the medication they take, I mean, long time when people got HIV, and eventually developed AIDS, they died in a short space of time. Now we see people living for decades, healthy, contributing productively to the economy, to their lives, to their livelihoods. And it's important for them to be employed because medication, I mean, thankfully, we do have the support of the Ministry of Health, and there's free drugs in the country, right? Of course, some of the best drugs come at a cost. I have a friend who owns a pharmacy. And I recall, because he said to me, they don't disclose it, but he said to me, he said, Cavell, you know, have some pretty powerful people who also suffer from diseases, and their drugs are delivered in the middle of the night to their homes. And they get access to the best because they import the drugs, right? As opposed to, I'm not saying that in our public health institution there isn't the best, but they look for the best, they pay for it, and it's imported and delivered home in the middle of the night. So they don't have to turn up at a clinic, for example.
And face that stigma.
Yes. And that's what we are trying to do, to break that stigma that goes along with it. So we want to ensure that we promote education. That was the key to the minister's message, even what Ruckus was saying earlier. Educating your workforce about it, first and foremost, that you don't have to shun someone who is positive. You're not going to get HIV by being in the same space with a person who's positive, right?
But I want to ask Cavell, in terms of HR's role in dealing with somebody who is HIV positive, is it as simple as keeping the information personal? Because I remember Kalisha was also talking about making that environment safe.
Yes.
So is it in terms of informing the employee that there's EAP services in case they need to reach out? How much is HR involved if an employee chooses to declare their status?
And that is what I was going to say too. Besides having a company's policy and whether we adopt the ministry's policy or develop our own, a company policy is important. Then, of course, the confidentiality and keeping that information, but ensuring that, of course, the environment is safe and that employee feels protected. Because we have a duty to all employees. The duty of care is to all, to ensure that, you know, DEI, because it is a form of inclusiveness, right? Inclusiveness includes people with medical issues, disabilities, things like that. And often we see, because someone with HIV is not protected under with the Equal Opportunities Act. They have to find other avenues for redress that includes disability, right? So we want to ensure, even with the EAP now, that support that is required. Now, when I volunteered years ago with that organization, I served 8 years on the board. It was my introduction to volunteerism, right? Father Harvey actually was the chairman.
Right.
Well, I should say Bishop Harvey now,
Yes,
right?
yes.
And I recall, in terms of that support, you see, because when you get the information and you know that you're positive, right? That psychological support is so critical to a person just not wanting to even commit suicide. I recall a few people did commit suicide because they felt like your life over, right? So that support through EAP and giving access to counseling services and all of that is critical. Keeping that person employed, because you need to have a productive life still. Your life needs purpose and meaning, and work gives us that. Work actually sometimes defines who we are as an individual. So we want to make sure that they continue to be employed in terms of again, in terms of bringing in, like how we have Will days, and organizations tend to use days like this to educate the workforce and provide information to their staff about it as well.
Now, Kalisha, I'm going to come back to you in a while, but I want to drill down on this a bit more, Cavell, because I know, for example, some employers will want you to do testing, right? They want to make sure that whoever is coming in the workplace is very healthy. And so some employers I know ask for a blood test. Can you refuse to do a blood test if you know that you don't want to declare your status at that point?
Well, it has to be a consent, because even with executive medicals, and most companies have executive medicals for their key people, annual checks, right? And when I go in for my executive medical, they do ask if I want to. They have to ask you that.
So you have to give consent?
Yes, you have to give consent.
Right.
And I just laugh because, I've been married, I've had one partner, right? So I laugh and I say, sure, go ahead. You know? And, it's nothing for me, right?
Yes.
But I have to consent to that.
Right.
Now, even with companies that have for health and wellness programs and health fairs, we tend to often provide testing services to employees, including HIV testing, only if you choose it. Right? You have to consent, same as the pap smear, any other tests that we provide for our health fairs. So consent is critical. And again, once an employee chooses to share that information with you because they want the accommodation, the reasonable accommodation, they may want to work in a different environment that doesn't expose them to unnecessary risk. It's our responsibility to treat that in a confidential manner and protect that person's interests and treat it as any other unique, diverse group. You know, we have all these things like affirmative action, where you try to ensure that you have the right gender balance, the right racial, ethnic balance. It's the same thing with medical issues as well.
I'm coming back to you, Kalisha, because I know that we have things protecting the employees. We have the ILO policy. Cavell would have mentioned as well that although we have this general policy guiding everything, the workplace can also have, or the employer can also have their own policy. But the HIV and AIDS positive person in the workplace, do they have rights as well?
Yes, they do, and they should be, because at the end of the day, they are human beings.
Right.
And this is what the policy speaks to. And along with the team of Willie's Day this year, in terms of equalize, this is what we are pushing for. Whether you're living with HIV or not, you do deserve to have human rights.
And what are some of the rights of somebody living with AIDS? Is it different to human rights, or is it similar?
No, it's the same.
Same rights,
At the end of the day, before their status, they are human.
Yeah.
And that is what matters. So no right should be minused or from them in any way.
Right.
Minused or adopted, not adopted, amended, sorry, in any way.
Yeah.
As long as that is what should matter. And that's why even in terms of speaking, we say persons living with HIV. We wouldn't say an HIV-infected person. Before their status, they are people, they are humans. And that is the key thing to remember. I may not be living with HIV, and the same right that is afforded to me, I expect and I would like it to be afforded to somebody who is living with HIV.
Now, one of the things you mentioned, which was concerning, of course, is that people living with HIV, they belong to that 15 to 49 group, which of course is our workforce, right? Do you have stats in terms of, as of now, how many people in TNT are living with HIV and AIDS?
There are approximately 11,000 persons
living with HIV and AIDS.
Yes.
Whose responsibility is it to educate the population? Like, for example, when I was younger, I would see these PSAs on television all the time, right, in terms of abstaining and that sort of thing. Do we still do those sort of things, and is that also under the Ministry of Labour?
To an extent in terms of the workplace. So our unit is responsible for the workforce. those PSAs, as you would say, would fall under probably Ministry of Health and other ministries that speak specific to that.
Right.
But in terms of the workplace, we work towards that. So we have posters, we have little radio snippets that persons may hear from time to time. So we try as best as we can to get that information out there, as well as our unit, we go to workplaces and we do sensitization sessions with organizations. Our services are free of charge. Persons, you can contact us.
Of course, you can plug it. Go ahead.
You can contact our unit in terms of development of your policy, information and education material, referral resources. Call our unit. Call us. Everything is free. We are willing to help. All we ask for is your hand in terms of reaching out to us. If we don't reach out to you first, and we are there.
Now, is the workplace policy available online, or is it only after you come in to speak to the employer, then we can get a copy of it?
The National Workplace Policy is available at the Ministry of Labor's website under the Resources tab. You'll see policies. It's right there. And we have it in Spanish as well.
Nice. And before we go, Kalisha, there's a MOU between the Labour and HERMAT. Who can speak to that? You or Cavell? You can speak to that
We
as
can
well?
both speak to
Yeah,
it.
so let me hear you first.
So one of these steps, it's not necessary, but we ask persons to do it in terms of formalizing the partnership between us and the organization is to sign an MOU. It's not legally binding. It just states the steps or the role, of both parties. So a role may be to develop a committee, to work on your policy, to host sensitization sessions. Specific to HERMAT, it will be to partner for training for their members. So we are looking forward to working with HERMAT in terms of that.
Now, the policy also covers sensitization as well in terms of how you can treat with a co-worker who is living with HIV and AIDS.
Yes.
And Cavell, before we go, because I know that you have so much experience in dealing with this topic, if it is an employee is mean or difficult with somebody who has HIV and AIDS, can you advise an employer what they can do in a situation like that? Because I'm not sure if termination might be the right route that they want to take, but how can you address something like that?
Well, it's just like any other situation where you deal with a grievance or you deal with conflict in the workspace. We don't want to treat it any different or say that because it centers around HIV, that we have to treat this so special. You know, the minute that people are not treating people with respect, not being facilitative, being openly aggressive, for example, and hostile, creating a hostile work environment, we have to treat with that like any other situation through the policies and procedures, disciplinary policies and procedures. And if it results in termination, it has to be because of the behaviors, because of the issues that arise, not to focus it on the fact that somebody was HIV positive or not, and that was the basis of it. You know, it's just like any other issue. And that's why it's so important what we're doing with the Ministry of Labour. We want to make sure all our members, because remember, HR is at the heart of this, right? We want to make sure all our members understand and appreciate this policy, that they adopt it for those who do not have a policy in their respective organization, and that they get access to the information by the Ministry of Labour. And we are going to partner going forward with the education and sensitization around this very important topic. Yes, we have another pandemic that has taken over, and I mean, everybody's talking about COVID, but HIV and AIDS is still around, and we don't want people to become complacent and think that this is no longer an issue. It's still an issue, and let's address it in a real way, just like any other health crisis.
And Kalisha, final thoughts before we close.
Final thoughts, let's equalize. I have a responsibility, Ms. Joseph has a responsibility, you have a responsibility. All of us have that responsibility to equalize in terms of the way we treat with HIV or the way that we treat persons living with HIV in the workplace. Let us work together to end stigma and discrimination in the workplace as well as in general in terms of how we engage persons.
And finally, just remind us where we can go to on the ministry's website to access the document.
So it's the Ministry of Labour's website. You'll see the resources tab. You click that and you'll see policies. Click the policies tab and you'll see all of our policies. This policy, remember how it looks. This policy is there in English as well as in Spanish.
Alicia Cavell, thank you so much for coming on the show, especially on this very important day, to educate us as it relates to the workplace policy for those living with HIV and AIDS. Thank you so much, ladies.
Thank you
Thank
for
you for
having
having
us.
us.
And that was Cavell Joseph St. Omer, the president of the Human Resources Management Association of TNT or HERMAT, and also Ms. Kalisha McLean Robert, who of course is the HIV/AIDS Advocacy Officer at the HIV Workplace Advocacy Unit at the Ministry of Labor. We're going to take a break and come back, but stay with us because Natasha is up next with A Thrill of Hope. Stay with us.
When they try to block, I still come again.